So when we think about infection prevention and control standards, there's a number of aspects that we need to consider from that. The first is around the standard and transmission-based precautions. So the highlights of COVID-19 has shown us the importance of PPE, particularly to, I guess, the non-clinical or the layman type person out there who may not have had exposure to the concept of personal protective equipment in the past. I'm certainly sure most people will understand that concept now. It's our very first barrier to trying to prevent infection. Importantly, hand hygiene is a key aspect of what we do. We know that hand hygiene is one of the most important aspects in reducing the rates of infection and preventing infection from being spread from patient to patient. Our clinical techniques we need to consider as well in terms of our aseptic technique. Are we doing surgical procedures in the right way? Are we actually introducing pathogens in our techniques or our procedures? So we need to take a bit of a look and reflect on our own aseptic techniques to make sure we are doing things the right way. Perhaps refresh that if it's new to you or you haven't done it for a while. We also need to think about the impact of invasive medical devices. As our digital and technological treatments have increased in a significant number over the last few years, we need to think about those types of devices that we're actually inserting into our patients and the dangers for those from our patients from an infection control point of view. We also need to consider the environments that we're working in. Most hospitals, care facilities, clinics are fairly clean and safe environments, but we need to be vigilant around that to make sure that they stay that way. If we can keep our environments clean, we can reduce the impact of infections in that impact where they're potentially harbouring in a dust on a windowsill or something similar. So obviously cleanliness and the way that we clean in our environments is certainly important to reduce that risk. Again, we also need to think about our workforce and what potential infections they might be bringing into our organisations. And it's important to consider workforce screening and immunisation to ensure that our staff are as safe as they can be and they're not causing any potential undue risk to our patients and consumers. The impact of infections in the workforce can be quite detrimental, as we've seen with the COVID-19 outbreak, where in a number of places, infections have gone through organisations, reducing the number of staff available. And of course, in a healthcare perspective, that means that our patients are not going to get the care that they require. So obviously an important aspect in terms of how do we actually reduce that impact on our workforce so that our clinicians can keep coming to work and caring for our patients.